To this now, Limpopo Premier Dr Phophi Ramathuba is expected to appear before the Health Professionals Council of South Africa tomorrow. This over her utterances captured on video to a patient from Zimbabwe back in 2022, in which she is alleged to have said that Zimbabwe does not assist with money to take care of its nationals being treated in Limpopo hospitals and that they were burdening the South African health system. Ramathuba was the Health MEC at the time. The hearing is set to resume tomorrow. We do have health activist Dr Kgosi Letlape, who joins us now for an overview of the conduct of health practitioners in the country. Doctor, thank you so much for making time to be with us today as always. So this story has resurfaced in a form of a disciplinary process against the Premier in relation to her utterances she made in 2022. Firstly, Doctor, in terms of the health practitioners' code of conduct, which parts was she in direct violation or contravention of?
Good afternoon to you and good afternoon to the viewers. I think that will be the subject of the inquiry in the next 2 days. And the reason there is an inquiry is because a complaint has been lodged. And in terms of the Health Professions Councils Act, any complaint needs to be followed. So it would mean that from those that did the assessment at the preliminary committee of inquiry, they felt there is a case to answer to. Remember, there are two things that we should separate. The issue of the facts that she was bringing to our attention, that is a real issue. The issue of the manner of how it was done, the context and where it was done, that would be the subject of the inquiry. But we must not be unmindful of the fact that we have a political conundrum where we have a constitution that creates an unfunded mandate. And part of the challenge that we have is that we have resources that are not sufficient for citizens, but have now been opened up for anyone from the world to come in. And that is a political problem that we would need to attend to.
So, Doctor, I was just on this question here on to further expanding on the ethics of doctors when providing treatment or care to individuals in need, be local or foreign origin. We hear terms like practitioners needing to have a certain bedside manner that makes their patients feel at ease. But this is obviously dependent on one's personality. You and I had a similar conversation about the matter at Helen Joseph not long ago, where the actions of those on duty were actually in question.
Yes, it is important, but we must also make the clear distinction that she was not a caregiver. She came there as a political official. She was not the one that gives care to patients. And it is fortunate that even though she was a politician, she's a registered medical practitioner, and we could have this form of accountability. If she was an MEC that was not a professional registered with any statutory body, we wouldn't be having this course of action. And that belies the importance of having people that are trained healthcare professionals in these positions so that we could expect a certain level of conduct from them, and they should know what can or can't be done to vulnerable people that are in our institutions for care, irrespective of their nationality.
Doctor, obviously we know that as doctors, as practicing doctors on duty, you cannot refuse to assist any patients regardless of their financial or socio-economic background or race, etc. Let's look at now the context that Dr. Ramathuba was actually questioning. I know you made reference to it earlier about the fact that the issues she was raising were actually correct. Yes, maybe her line of questioning was directed to the wrong individual, but the reality is, Doctor, we do have an overburdened public healthcare system, and this is largely due to undocumented foreign nationals flooding our hospitals. So in this case, how should the doctor then have addressed this issue?
I think we should make the mistake that it's undocumented, because there are even documented foreign nationals that come here to use our public healthcare system because of the openness of our borders, the vagueness of our constitution, the founding statements of the Freedom Charter that say this country belongs to all those who live in it. The challenges that we've created about talking about access, free access to care for under 6-year-olds and pregnant women without defining the rights that are for citizens and residents. So we've made it open to anybody. Any of the 8 billion inhabitants on this planet can rock up here if they are pregnant and they have to be taken care of. Any child that is under 6 on this planet can rock up in South Africa and we're going to provide them with care. We are not even conforming to international norms or talking about the status of the person, refugees. We are not even asking that if you come here as a foreigner, have health insurance, even if you are documented. We're not asking for those issues. So all those people that come in here, even those that are documented, when you have papers, you can come here highly pregnant and you have papers and you walk in institutions and you come late stage of pregnancy and we have to take care of you. That's the situation that we've created. It's political mischievousness, where we're trying to look good to the international world, where we are having a constitution that is an unfundable mandate, because we are not limiting certain rights to citizens. It doesn't really matter being a citizen. You're going to be crowded by people from elsewhere because of the Freedom Charter and the way our constitution is being interpreted. Because the rights are not, they are not separate rights that are reserved for citizens. Everything that we derive, free housing. You come here as a foreigner, you occupy a corner of the land, you're not detected for 4 days. Suddenly, we have to give you alternate accommodation before we evict you, even though you are a foreigner, even though you occupied the land illegally. So we have a nice constitutional framework that is unfundable. That's a political issue that needs to be sorted out. And she was coming there as a politician. And where she should have gone with those issues was to go to a political party, go and check the issues of, does our constitution put us in this position? But here's the funny thing. This openness is only in the public sector. So me and you, we are sheltered from this because we get our help, we've got medical aid, we go to private hospitals, and all these people that are supposed to get all this free care are not going to interfere with our liberties and our privileges in the separate advantaged South Africa. These are people that have an impact on the South Africa, where the majority of South Africans, where there's an adverse impact on our public sector. If we're going to have policies like this, we're going to ensure that they are properly funded so that ordinary citizens are not disadvantaged. You go to Rahima Musa Hospital, you find an overbearing system where there are no beds for pregnant women. You can't plan properly because you're not planning for 60+ million South Africans. You're planning for an indeterminate number. As long as you can come across documented or undocumented, we're going to take care of you.
Yeah,
we have a challenge that is unfolding in the minds that we're talking about.
Absolutely,
Doctor. And people are acting unlawfully, and we then say they have rights, but they're not responsible.
Doctor, and this is exactly the correlation that I wanted to make. It seems like, you're going to have officials that find themselves in a catch-22 situation because obviously of the political conundrum that has been created, an environment that, as you've pointed out, leaves those that are then tasked with ensuring that they meet out either the laws or their duties. They're confronted with situations that they just cannot handle. So the hearing in the case of Dr. Ramathuba has obviously been postponed for today until tomorrow. But Doctor, maybe just your overall observation then on or your remarks and even advice to your former colleagues who find themselves confronted with this very same situation.
I think my comment is I commend Dr. Ramathuba for availing herself to the processes that we subscribe to as registered professionals. But I think now that I'm a politician, I've got to take up the issue that she raises, which is critical. And unless we talk about that issue, our country will continue to be ungovernable, our country will continue to be unsafe, our public sector will continue to be overburdened, not work, and to be overrun. So what you have here is political problem, where there's no sound leadership. We've got to stop trying to be the experiment of the world of goodness at the expense of our citizens, at the expense of lawlessness, promoting lawlessness in our country, and endangering the lives of ordinary citizens. While those of us are privileged live in a sheltered, protected environment in the better part of South Africa that serves 10 to 15% of the population.
All
we
right.
need to be one nation, one health system, and the politicians must make decisions that impact on them personally. We must get our health care from this.
All right. Doctor, thank you so much for your contributions as always.